Hi, I'm Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show. Welcome back to Health Futures, and today I have a guest that I just met literally a couple months ago, and you know what? She is changing the landscape of way care is being delivered for people that are challenged with dementia and Alzheimer's. And I'm really excited about having this guest here in the studio with me. I have Angelica Catusco.
Yes.
Welcome to Health Futures.
Thank you so much, Bob, for having me. I'm so excited to be here today with you.
And you have this company called Dementia Docs, and I have a theme that I created saying, living well with dementia, restoring hope, preserving dignity, and supporting families. And I think you do all of these things.
Yes, I definitely do.
I want to really start by just saying, every 3 seconds, somebody in the world is facing a diagnosis. You have chosen this profession, and I want to know, and I know our listeners and viewers want to know a little bit about you and why you chose this profession. Sure. I know you're an occupational therapist.
Yes.
But there's a story behind it, and there's also a connection to Brooklyn.
Yes.
Before you got here to Scottsdale. So please tell me,
sure,
our listeners and viewers, a little bit about yourself.
Perfect. Thank you so much, Bob. So my name's Dr. Angelica Catusco. I'm a licensed occupational therapist, and I was born and raised in Brooklyn, New York. Right? I grew up in an area where 3 generations lived in one house. Culture is really important to me. Coming from an Italian background, you knew all your neighbors, everyone knew you, and everyone came to help support. So coming from that type of background, it's second nature to me when patients need you that it really is an extension of your family. So my parents worked full time, and I was practically raised by my grandparents, my mom's parents. And I'm so grateful that I got the opportunity to spend so much time with them when I was a lot younger. Right. They were a lot older when they had my mom, so just that time there with them was just really precious. And as my grandma aged and got older, we moved her to an assisted living facility closer to our house. And at the time, I was in graduate school, and I watched my mom take care of my grandma, pull out her back when transferring her in and out of the car, while also simultaneously working full time, being a wife, raising my younger brother. I just saw the amount of stress and pressure that it put on my mom, someone who isn't formally educated as a family caregiver, who didn't know the ins and outs of the medical care system. And it had me thinking, well, what support is out there for family caregivers? And that really is what started my passion for the Dementia Docs, and where that was kind of step one, and that's kind of where we're at today.
So when did you get here?
Yeah, so I had a little bit of back and forth.
Yeah.
So
and what brought you here?
Yeah, I went to the University of Arizona.
All right.
Actually, my bachelor's. Yes, I had a great time.
I'm sure. All 3 daughters went there too. So were you part of the Greek system too?
I was. Yes,
there you go.
I was a part of Alpha Chi Omega,
okay.
And I was on the Greek Standards Board as well, right. And an academic advisor. So I really
an overachiever.
Basically, a big nerd, right? Anything that I was interested in, I decided to sign up and give it a try, and most of those things I ended up really enjoying. But
and why Arizona? I mean, you could have gone anywhere, and you're from Brooklyn, so I mean, you made a big move, and I imagine your family was just like, what?
Oh, absolutely. I can't even tell you the amount of my family members that are like, what's even out there? Right. They still don't know what's out here. They feel like it's just, dirt and dust storms.
I mean, New Yorkers think that that's the place to live.
Yes.
Right?
Like my whole family grew up in the same 5-mile radius and have lived there their entire lives.
Wow.
So it definitely was a big change when I decided to go to U of A for undergrad, actually. At the time, I was between Purdue and U of A. And I was really young and wanted a whole change of scenery. I wanted a life that I can create for myself from scratch. Growing up the way I did, it was really common that, you knew everyone throughout your entire life, and I wanted to make my own community based on the people that I would meet. versus like kind of that built-in network. I thought it would be a really good opportunity to grow. And at 17, I made the decision to move across the country without knowing a single person. And it was the best decision for me. I learned so much from going from a really shy girl in high school to, thriving in college. Oh, yeah. I loved it. I loved every part of it.
Had to help.
It definitely helped get me out of my shell. That's for sure. That's for sure. And I had a little bit of back and forth, actually. So I went to U of A for undergrad, back to New York for graduate school. And then I told my graduate school, home to me feels like Scottsdale, Arizona. If I can get my own rotation signed, will you support that decision? And they said yes. And that wasn't very typical for the program that I was in. It was more typical to have a residency rotation in the tri-state area.
Right.
So that was a little bit different. And I was like, that's where I want to be. I want to settle down there. There's a population that needs me. And I would love to bring the education that I've learned from New York cross country to Arizona.
So you did clinicals here?
I did.
Where'd you do them?
Yes, I did an outpatient clinic in Peoria.
Oh, nice.
And so through that rotation, I was able to work with pediatrics, geriatrics, and then home care, which was really interesting. I learned a lot. I'd have one patient for a knee replacement. The next person would be a child that had needed feeding therapy. It was kind of all over the place. So I got to learn a lot really quickly. And then my second rotation was at Encompass Health in North Scottsdale for inpatient rehab, which I absolutely loved. I really love the medical model, and being able to see so many interdisciplinary teams work together was something I really enjoyed.
Were you there post-COVID or pre-COVID?
Post-COVID, actually.
Post-COVID.
Yes.
And how far post-COVID? Because it made a big difference in that setting.
It did. We were masks 24/7 when I was there.
Wow.
And I remember patients were eating in their rooms. So there wasn't as much of a community. Yeah, it wasn't open. They weren't going back to that. I remember us running more group programming at that point, and clients really enjoyed that. Being able to relate to other patients that were in the hospital really helped their recovery. So that was really enjoyable to have occupational therapy groups where other patients can relate to one another, because that was an opportunity they didn't have post-COVID with having lunch and all meals in their rooms.
Yeah, we're social people. We need that.
We do need that. It really helps your recovery, no matter what you're going through, having that sense of connection with someone else.
And really for our viewers and listeners, if I remember correctly, Encompass also has an outpatient center too. So were you working with outpatient as
They
well?
used to. I think that may have closed actually.
Oh, okay.
But the location that I was at had an aquatic pool, so that was fun. I had a few experiences where I got to help oversee some therapy sessions in that
pool,
which was lovely.
Oh, yeah.
For some patients to feel like they weren't in a hospital system. It felt more normalized.
And the weightlessness helps too.
Yes.
Takes a little pressure off those joints.
Absolutely.
Yeah,
it does.
Especially following an injury or surgery.
Yes, it definitely helps with that recovery.
All right, so I think I followed this path, and you were down in Tucson. You got a chance to do your master's back in the Tri-City. You got your clinicals
my doctorate.
Doctor. You did that in Tri-City, and you came back here to do your clinicals. So, Dementia Docs.
Yes.
So tell me how that got born.
Sure. So I was working in inpatient rehab hospitals. I was working in one full-time, another one on the weekends, and then I was consulting for a major university on the East Coast. And I got that contract.
Can I ask which one?
Sure, Rutgers University.
Yeah, just a little one there in New Jersey.
Yes, just a little one. They've been wonderful.
Yes.
I might take you back.
Right?
Yes,
there
yes. For my residency in my doctorate program, I ended up developing a 5-week program to improve the quality of life of family caregivers. Oh, wow. So after watching what my mom went through, that kind of had me down this rabbit hole of, what's out there for programming for families? So I learned that there wasn't that many options at the time, and that was post-COVID. Mm-hmm. And so I decided through my literature review and through the research that I was going to run a 5-week program incorporating individual and group therapy sessions for family members, and that it would be focused on the 8 dimensions of wellness. So looking at the full person, using a scope of practice for occupational therapy, and then providing accessible care through Zoom. So I ended up creating a needs assessment, interviewing a lot of therapists as well as caregivers to really shape the program so it met the needs of these families. So I ran this program, and Rutgers was a mentor for me on this project. So my relationship with them began really early in grad school. And by the time I ran and completed my residency, they offered me a position there as a consultant to run group programming for them, which I absolutely loved.
Oh, sure you did.
And that really kind of started my whole path with continuing with dementia and supporting these families. I had a few patients and families that I worked with then that I didn't just end my care when the program ended. I knew they still needed me, and so I continued pro bono helping some of these families. So I have maintained that relationship that whole time. So it was actually last November, I was working in this inpatient rehab hospital, and there was 5 families that I was really advocating for. They needed more education. I felt like, we were kind of overlooking them in the healthcare system, which happens all the time, right? Not that it's right, but that is sort of how the system is. And
Totally.
it helped me as a clinician learn the ins and outs of, okay, I need to bring case management in. I need to lean on the physical therapist. I need to have the social worker, send this referral in. It really helped me to solidify all the pieces that went into a hospital care system and how the family needs to understand how the system works and education along the way. And it was around that point where I decided, I think I need to advocate for these families in a different way and provide therapy outside of just the hospital environment. And that's when the Dementia Docs was launched.
Wow. I love the fact that it's a personal journey. It's a story that fueled your passion, and it really started at home because you saw exactly what happened with your mom caring for your grandmother.
Yes.
I mean, that's really, really hard to see, but rather than say, woe is me, you're like, hey, I'm going to change the world. I'm going to make it a better place. I'm going to give family caregivers the tools to be able to care for their loved ones.
Yes.
And essentially, that's what it really is, right? You can't do the work. You can guide them and give them the tools and teach them. I mean, one of the things I learned early on, and you and I may have talked about this, but everybody in the world feels like, the best way to handle somebody with dementia or Alzheimer's is to redirect them. Well, no, it's not to redirect them. You have to validate their feelings.
Absolutely.
You have to help them understand that feeling they're feeling, even though it may not be real, it's real to them.
Yes.
And I think people lose sight of that.
They do, and they don't know how to handle it, right?
And you got to be in their world, right?
Yes, absolutely.
Yeah.
I tell my families, you want to join their reality,
Right.
right? The same way, if you're really convinced that something is going on, you want to feel validated and then encouraged to do something else. And I will say, from the occupational therapy perspective, right, we want to make sure that the caregiver is providing their loved one with the tools to be as independent as possible. Because the more independent the person is that's living with dementia or Alzheimer's, the less burden that the caregiver has to carry and hold. So really empowering them of what is meaningful for the person living with the disease, that, living doesn't end just because you have a diagnosis.
Right. And it's a great segue, because families hear that your loved one has Alzheimer's and then they feel hopeless. And, for me, I've had in the studio here, I've had Dr. Pierre Terrio, I've had Dr. Eric Ryman, I've had a number of other people, Dr. Jessica Langbaum here in the studio. And, it's the way it always was diagnose and adios. And, I guess my question is when that happens and they come to you, what's the first thing you tell them?
I most of the times want to just give them a big hug, right? That shouldn't have been their experience.
Right.
I'm sorry that happened, but there's another way. And it doesn't just end with the diagnosis. I actually had a family not too long ago give me a call and tell me about her experience from diagnosis to meeting me. And she told me that the neurologist gave her a call on a Tuesday morning and said, "Good morning, hope you're having a good day. Good news, we got this diagnosis back."
Good news.
Good
I'm
news.
going to ruin your day.
Yeah.
I'm going to ruin your day.
Yes, 100%.
Yeah.
And she got this call, good news, it's frontal temporal dementia.
Oh.
And she's in the middle of her workday.
No, that's one of the really
ones.
worst diagnoses.
Yeah.
That's so sad.
So sad. And she had no idea what to do with this information.
Right.
She said, "Angelica, I was sitting down and I just started shaking. I didn't know what this meant. What did this mean for my family? What does this mean for my husband? How am I going to go on? And I still have 6 more hours left of my workday. What am I supposed to do?" And even I think it starts at that diagnosis, really even doing some education for other healthcare practitioners of how we go about having an empathetic conversation with our families of, this is what the diagnosis is, this is what it means, and this is the person that's going to help you with the next step. As an occupational therapist and a dementia practitioner, I'm the one that could be involved in those conversations to make the process a lot smoother for these families.
Well, you give them a roadmap.
Exactly.
And that's the thing. I mean, they don't know. I mean, you send them home, and then it's just like, okay, what do I do now?
Yes, and it's Dr. Google,
yes.
right? Which could be the worst thing for these families.
It is usually the worst thing, and most practitioners say, don't go to Dr. Google, and that is really, really tough when you get stuck with that. What would you say, or should I say, how can someone live, because you started on this, a meaningful life with a diagnosis of dementia?
Absolutely. I think really focusing in on what can I still do versus what I can't do, right? Life might look a little bit different, but it doesn't mean it's over. I think really starting with what are some of the goals that I have and who can help me, getting the best team in my corner to help me live a meaningful life still. Even the compensation that could help these families and the person living with the disease of, okay, I'm going to adapt this task so I can be the most independent and successful. I like to look at, the first thing that I do actually when I walk in the door for an evaluation with families is I look at their environment. I look at the relationship supporting the person. I'm looking at the entire family unit, right? So if the caregiver is feeling really overwhelmed, the person living with dementia is also going to feel that energy. So how can we make those little shifts that could really make a big difference?
It's interesting how you talk about the energy.
Yes.
Because it's sometimes can be very palpable both ways, negative or positive. And a lot of times the caregivers don't realize that that's what they're putting out there.
Especially someone that you love. There's a lot of research that shows that when you walk into the room with someone that you love, your heart rate and their heart rate sync up, right? So they can feel what you're feeling. So if you're going into the room really calm and collected, that gives someone else a breath of fresh air because then they feel that way too. And that makes a big difference, especially in dementia, when sometimes our loved ones can't communicate the way they used to. And they really are responding to the tone of our voice, our body language, how we're approaching the situation.
What are some of the biggest myths that...
Yeah, the first thing that comes to mind is even when it's the first one is that memory loss is a natural part of aging, right? So a lot of family members think, well, grandma was losing her memory. That's just normal. We're getting older. But that's not a natural part of aging, right? So making sure that if you're forgetting things or misplacing items around the house or even getting lost within your community, driving home late, that isn't necessarily a sign of fatigue or getting older. That's your first step of, I want to get assessed to see if I have any cognitive impairments going on, right? Because preventative healthcare is a lot better than reactive healthcare.
100%. I guess, and you hit on a part here about the diagnosis and, the myths that come along with it. What is the difference between normal aging and mild cognitive dementia or impairment?
Sure. So when we are aging, right, maybe we're forgetting, where's my car in the parking lot? And then a few minutes later, you're like, oh, there it is. That's pretty normal if you're going to the same supermarket every day and you're parking your car generally in the same spot, right? There's moments I do that all the time. But the difference is when you have parked the car and you have no idea how you got there. You don't remember how you left the house when you left the house, right? It's seeming a little bit spotty. Or you remember that maybe it's lunchtime, but you don't remember that you already ate, right? Or you're finding your car keys in the refrigerator. We see that a lot, actually.
So let's unpack a little bit about the eating.
Sure.
Because that's one of the things that I learned when I first got into the home care business is those that have dementia and Alzheimer's, this gets disconnected. And for those that are listening, I'm pointing to my brain and my stomach. And, oftentimes Alzheimer's patients, they don't feel the hunger pangs that we do.
Yes.
And if you ask them if they're hungry, no, they're not. And if you ask them if they've had lunch, oh, yeah, I had lunch, but they really didn't. And one of the signs, and I know you'll admit it, you'll agree with me, is that weight loss,
yes,
if that is happening, there could be a problem here.
Absolutely. And you see that rapid decline. I also like families to notice, too, if their loved one is having any hearing loss. That's also a sign that we want to make sure we're addressing that.
Oh, Susie. She accuses me as conveniently not hearing or maybe not hearing.
Selective
but I've heard
listening.
that before. Selective listening, exactly.
Yes. Well, when we think about hearing loss and we start to lose our hearing, that's a whole area of the brain that we're no longer utilizing. And our auditory system is responsible for a lot. So we're not hearing as well. We're then less socially engaged. We're isolating ourselves more and more in the community. And then we also see a decline that way as well.
100%.
So really a great investment is making sure you're getting your hearing tested once a year.
Hearing aids have come down a lot in price. You can buy them right off the shelf now, and they're pretty good.
Costco's a great resource for that.
Yes.
Absolutely.
I find myself, because I'm a little bit hard at hearing, I did go get my hearing checked. I find myself working harder to listen and be more engaged. If somebody is, if it's really loud, I'm leaning in and I'm listening. But
do you feel like you're reading lips at all?
not really.
Okay.
Not really.
Okay, that's good.
I don't think I'm a good lip
Okay.
reader.
That's good. And I will say it's good that
We're getting a diagnosis here, okay? So just so you know, Dr. Catusco is going to let me know whether I need hearing aids.
well, I'm glad that you're on it. I'm glad that you're
Thank
going
you.
to the doctors and not dismissing the problem. And
Right.
there's some times
and
too.
missing out.
Yes,
right?
absolutely.
Missing out on life.
Yes, and a lot of times, right, we get older and we get afraid of going to the doctors. We're like,
Right.
is it really a big deal or not? You don't know when to go, when not to go. And I think you rather be safe than go in too late.
Exactly.
Right? So if you're having any question, it's better to book the appointment and get it checked out, get an assessment.
You can get it checked at Costco, right?
Yes,
You can get
yes.
a hearing check there.
Yes.
So there are
And it
lots of
can feel
places
more
to go.
normalized. Absolutely.
No, thank you for telling me that. All right, so you're an occupational therapist. So tell me a little bit about occupational therapy and really, why did you choose that? I mean, your destination ended up being in the world of dementia.
Yes, it
But,
did.
and I will share for our listeners, my dad, who has been on the show before, and, his last couple years of life were really challenging. And I'll never forget, and you might laugh, I hope our audience laughs a little bit too, is, he was inpatient at the hospital, and in walked an occupational therapist, and he asked them, and he was really particular, because doctors came in and out, and he said, can I take a picture of your badge so I know who's here? And said, occupational therapist, I've been retired for over 30 years. What do I need an occupational therapist?
Yes.
I don't need a job.
I don't need a job.
That's what he said. I don't need a job.
Well, I get that all the time. We all do. We really do. It's confusing.
It really
I've gotten,
is.
do you work for Indeed, right? I'm like, no. It's completely different.
I'm a doctor of,
Yeah.
of Indeed, right?
Yes, right? No, I'm like, no. It's funny that your dad felt that way.
He
and
said
thought
that. It was really funny.
Yeah, I mean, a very common misconception about our field. For occupational therapy, we look at the full picture. So when we view occupations, it's meaningful activities that occupy your time, right? And your engagement and your ability to live your life as independently and as successfully as possible. So looking at your environment, looking at your person, looking at your mental health, your emotional health, the relationships you have, the community that you're in. You know, are you able to do all your ADLs when it comes to eating, feeding, grooming, dressing, bathing, showering?
Going to the bathroom.
Yes, toileting. That's a large scope of my practice.
It is a big part.
Big part. Or, you know, instrumental activities of daily living, like community engagement, socialization, driving, the impact on that. Anything that brings engagement and meaning to your life. It could be gardening, wellness. It really could be anything that you're passionate about, right? That you need some functionality with in order to do the things you love.
Right. And that's what you pursued, and you got your PhD in that. And,
yes.
And we all know why you chose to help with dementia and
yes.
help families out.
So why OT for me was, again, another family member for me brought me to the scope of practice for OT. My younger brother, when he was born, he was diagnosed with craniosynostosis. What that means is the bones in his skull were fused together at birth, putting pressure on his brain. So when he was just a few weeks old, he had to have craniosurgery to relieve the bones, and they put springs actually in his skull so that his brain can continue to develop without that added pressure in his brain.
Is this why babies have the soft spot?
This was actually a little different. So his head shape almost looked like a football.
Okay.
So the shape of his head wasn't the way it was supposed to be.
Got it.
So you want to make sure babies, when they're developing, that it's a very round head.
Right.
And yes, their babies' heads are very malleable at that age because the bones haven't fully developed.
Right. And I know my first came out with a little bit of a cone head.
Okay.
It goes back.
It got better. That's good.
Back.
It's good that it got better. Those early on pictures are always fun. Always fun to look at.
That's why they put those knit caps on.
Yes.
So you can't really see.
You can't really tell. You can't really tell.
But literally within like a day or two, I mean, it's incredible because their cells are multiplying so fast.
Yes, and babies are so resilient.
Yeah.
They really are. And at that point, actually, that was my heart goes out for my mom because she advocated for my brother so much with him. When he got older, he was around 6 or 7, and my mom was noticing that he was having some developmental delays. And going from having me and then having my brother, she's like, you know, well, my daughter was able to push herself on a swing, and she was able to ride a bike, and she was able to feed herself at this age where now, you know, my son is having a really challenging time with this. She was bringing it up to the pediatrician at the time, and the pediatrician said, oh, it's natural, it's normal. My mom's like, I don't feel like it is. And this pediatrician...
Boys and girls. You know, girls develop sooner, right?
Yeah, you know, it was just shrugged off. But it didn't sit well with my mom, and she ended up joining some Facebook groups and different communities and diving into research about cranio babies and what that looks like as they get older. What's normal for developmental milestones for babies and children that have gone through that. And she found a whole support group.
Wow. And
it really was that support group that had my mom go through different avenues. And one thing led to the next, and she got an occupational therapist on Austin's case. And I remember taking him to some of his appointments and watching this therapist instill so much hope into my family's dynamic. I was like, that is exactly what I want to do.
Wow. How old were you back then?
I was about 17. So I was already in college at that point. And I switched from pre-law to neuroscience, just like that.
I'm so glad you did.
I'm so glad I did too.
We don't need more lawyers.
No.
We need more people like you.
Well, thank you.
Yes.
But so I will say, you know, from the Dementia Docs and occupational therapy, all that I do really attributes back to my family, right? So it's family-centered care. It's a relationship-driven approach. I know what it has felt like being on the receiving end of healthcare. I've watched how that affected not only myself, my family's dynamic, but a mother advocating for her mother and a mother advocating for a child.
You know, your sweet spot is the family caregiver. And,
it is.
And that's where you and I are in sync, because that's what we talk about and that's what we live every single day. I mean, the whole purpose behind our company at Cypress Home Care is be respite for family caregivers. There's 63 million of them out there making an incredible sacrifice, in a lot of cases, ultimate in their lives. and they give up so much to help a loved one. What would you say the biggest mistake family caregivers make?
They neglect their own self-care in the process. So
I can see that.
yeah, did that happen in your family?
Oh, yeah.
Yeah.
Totally. I mean, we're totally dependent on caring for someone.
Yes.
But not to the extreme that I see in the cases that we care.
Okay.
Especially when you were talking about two older adults.
Yes.
I mean, let's face it. The data shows that couples 65 and older caring for one another without assistance from the outside, 63% of the time, the caregiver predeceases the care recipient.
Yes.
Because they need that help. The emotional and physical toll that it takes on the human body is so overwhelming.
It absolutely is. And that is really, a scary fact of where we're at right now in healthcare in America too, right? If our family members have a higher mortality rate than the person that they're taking care of, it's like, well, what's going to happen to the person that has this dementia? Right?
Who's going to care for them?
Who's going to care for them if you're not caring for yourself?
So how do you know, or how can we impart to them so that they know that they're burning out?
Yeah.
I mean, that's...
Some warning signs of burnout for family caregivers. I like to even bring them back to basic needs, right? Are they getting enough sleep? Are they feeling fatigued throughout the day? Are they eating enough? Are they moving their body? How does it feel inside of their bodies? Even I'll have caregivers do a body scan. Close your eyes, take a big deep breath in, a deep breath out. And are you carrying any pain in your body? Anything that maybe you're noticing now that you didn't notice earlier? And when was the last time you sat down and had a whole meal without rushing? What does that look like? When's the last time you went to a checkup for you? Are you missing appointments and taking your loved one, but not also getting that care for yourself?
I love that you talked about breathing. Breathing, I'm a yogi, so I mean, breathing is so vital. And just taking a couple deep breaths can really change your altitude.
Absolutely.
And what do they say? Your altitude really predicts what your attitude is. And,
yes.
and breathing is so important.
Yes. It really comes down to the basics.
Mm-hmm.
Taking a minute to pause. I also am a yogi, and I like to incorporate breathing, grounding rituals, looking at our spiritual sense as well, which is in my scope of practice as an occupational therapist, right? So bringing in hope, even giving caregivers, and I'll tell them too, I'm giving you permission to care for yourself.
Thank you.
Right? If someone didn't tell you that today, let me be the first one to tell you that it's okay to care for you.
I'm the doctor here. I'm giving you, this is my prescription to you.
Yes.
Yes. Take care of you.
Absolutely.
So my question here on family caregivers, the last one, if someone were listening today and just learned that their spouse or parent has dementia, what are the first three things that they should do?
Sure. The first thing is to take a deep breath, because truthfully, the diagnosis just gives us a place to start. It's not an ending, it's a place to begin. The second is, let's look at the care system and let's see if we can get a good team of healthcare providers in your corner, right? The neurologist, an occupational therapist, a physical therapist, a speech therapist. And then my third, I would say, making sure you're looking at the home environment for aging in place safely, right? Is there any tripping hazards? Is there any ways that we can improve the environment for increased independence? Knowing that this is a progressive disease, but not losing complete hope just yet, right? If we bring in the right team where you and your entire family system feel supported, it could really make a huge difference. You don't have to carry this weight alone. We can help with that.
And I love how you phrase that. I mean, because I think so many feel like they're alone. And, this generation that is now unfortunately passing on, they literally took the oath of sickness and health, literally.
Yes.
And they feel like that's their responsibility. And, we need to help them understand it's okay to ask for help.
Absolutely. And I see that a lot. I run some support groups for different populations. I run a spouses caring for spouses that are going through this process. I run a support group for long-term caregivers that have placed their loved ones in a facility. And then I also run an adults caring for adult parents support group. And depending on the relationship that you have with a person living with a disease really does influence how you take care of yourself, how you view the situation, how you deal with burnout and stress. I also see a lot of the times as well is our loved ones that are diagnosed have a history of mental health illnesses and sometimes have complicated family dynamics with the person that is taking care of them, right? So making sure to give yourself grace as a family caregiver in the process, that the hand that you're dealt is not an easy hand. And if there becomes a point where you need to bring in a caregiver into your home or even place your loved one into a facility, that it's not that you're failing or you're not succeeding. It's a good thing to admit that you need more help. Because a lot of the times, as I know from my background, being raised in Brooklyn, it takes a village. It takes each generation to help support each other. And it's those relationships that really do make a big difference.
No, really sage advice. All right, so you're talking about a lot of support groups.
Yes.
I'm going to ask you at the end, but for those that are here, we're at the middle, maybe 2/3 of the way in. Tell our listeners and viewers, how do we find these support groups?
Sure.
Because I think, they'll want to find out how to connect with Dr. Catusco.
Yes, sure. So you can find me on my website and send me a message that way that you're interested in a support group. But I also like to point...
What is the website address?
The dementiadocs.com.
Okay, thank you.
Yes, you're welcome. And then I like for caregivers to look at their local Office of Aging's website and looking to see what community resources are on there for them. There's also a lot of local hospitals that run support groups that they can rely on. Alzheimer's associations also has support groups, but one thing to keep in mind is sometimes they're limited and capped at a certain capacity. For the ones that I run, it's actually through my other state, so it is specifically for New Jersey caregivers.
Okay.
And I'm really excited about getting more involved in the state of Arizona here now with providing more family support through more groups here.
We're going to work on that because we
Amazing.
need people like you. And really, I want our viewers and listeners to really understand why is it so powerful to be in a support group? Because for me, I know that so many of these are these caregivers, these family caregivers feel like they're the only ones that are going through this. They have no one has any idea what I'm going through. But when you're in a support group, you're amongst peers, right?
Yes, you are. And it makes the biggest difference. A lot of these caregivers, whether or not they are in a large family or maybe not a large family, they might be the only one that's providing this care, right? And their friends maybe have fallen away or maybe have passed away at this point of time if they're caring for someone that's older than them. But being in these support groups, it allows you to really hear the stories of other people. You don't feel as alone. There's a lot of times throughout the support groups where I'll have everyone pause and take a deep breath together. When's the last time you intentionally took a deep breath? Or, I hear that everyone is having a hard time today. I want everyone to take a minute and write in the chat, what's something that you would tell another caregiver in this group of that they're doing a good job, right? That they're doing the best that they can do. And I will say it's really beautiful to see the relationships that develop in these support groups. Like I mentioned, there's groups where you're hearing about a spouse taking care of their husband, and then you're also hearing the perspective of an adult caring for their 50-year-old mother that was recently diagnosed with an early onset. Everyone carries different perspectives, and even though their situations are a little bit different, it's that hope, that sense of community, it's those relationships. And it's just, there's a lot of groups that just bring tears to my eyes to be a part of, to facilitate, and it's community coming together for community.
When you talk about relationships, and I'm sure that there are friendships that are made through these support groups, and while they're supporting one another in groups, they probably break off into little micro support groups, and then they go have coffee and compare notes and become friends. So It's a liberating experience.
It
and
is.
It's one that, I have an extended family member that is not really going that way, and I keep trying to push. You need to be in a support group. You need to know that you're not alone.
And I would tell someone like that, like, your extended family member, to say, even if you were just a fly on the wall, turn your camera off. You don't have to speak, but maybe just listening.
Right.
Listening to other people's stories and experiences. One caregiver might share something that maybe you're experiencing or have not yet experienced, or is just more food for thought. I gain a lot of knowledge as a practitioner. I learn from the clients that I have in my support groups just as much as maybe they learn from me.
Right.
And that's a really beautiful thing.
Oh, sure.
So
dementia care is changing rapidly, really rapidly, and it needs to, because the numbers are daunting. We know there are about 16 to 18 million family caregivers that are caring for a loved one with dementia or Alzheimer's. What excites you most about the changes that are coming forward?
yeah, what excites me most is that more people are talking about it. It really starts with awareness of this aging population, awareness that these families need more help, awareness of what practitioners can do to help these families. And then this piece of education, right? So that companies are educating their caregivers involved. I know actually Hospice of the Valley here in Arizona is providing free memory care training for anyone that's working in a facility that has memory care patients, right? So it's important that more of our population is getting educated on the signs of memory impairment and what to do about it, interventions to take, support to reach out to. It's really exciting because we don't know what we don't know. And the fact that people are talking about it, it's bringing more awareness, more education, and we all need to lean on each other with that.
Well, and I think the other thing is the fact that the Center of Medicare and Medicaid Services a couple years ago realized this and created the GUIDE program.
Yes.
And we are a participant in the GUIDE program, and we are a participant with Hospice of the Valley and Banner Alzheimer's Institute here in town. And, the fact that CMS realizes that this is a problem, and they're not focused so much on the patient, it's the caregiver. Absolutely. Giving them relief, giving them 72 hours of time for themselves. Now, to some that's not enough, but at least it's something.
It's a start.
It is a start. And, we need to give those caregivers the respite that they so need. And I say this all the time on my radio show and podcast now, is that, look, there are people, and here in Arizona, very different from Brooklyn, we build walls. And, I've lived in my neighborhood for 32 years, and 32 years I've gotten a chance to know many neighbors, but there are some neighbors I never got to know. We didn't have open backyards. And I often say, look, know who your neighbor is, observe, see who might need some help.
Absolutely.
Family caregivers don't always ask. They don't. And if you ask them, they'll just say, no, thank you. And I always say, don't ask, just do.
Yes.
Just drop something off. If you're making a casserole or a meatloaf or whatever you're making, make two and drop one off and say, I was thinking of you.
That's one of the best things that people can do to support these families, actually,
Right.
is making things a little bit easier. Acts of service really go a long way with this demographic.
And observing your surroundings. You
Yes.
said earlier on, when you're working with patients, you're doing a needs analysis. You've got to really understand what they're needing. And you need to know, who is in your neighborhood? Who's in your circle?
Yes.
Who are some of the employees that are working for you? Because that's the other challenge we have, is we have so many people that are missing work because they need to be there for their parents. And whether it be a caregiving role, it's still a caregiving role, taking them to an appointment. And maybe there's an injury where they have to be going to the hospital or going to the rehab center.
Absolutely.
It's really, really difficult. AI. AI is the buzzword. So can AI improve dementia care? And where should we be cautious?
Yeah, I think, when we're thinking about education, like for family members, making sure when we're talking to AI, maybe we're asking, I want evidence-based research on XYZ topic, right? So that we're really consuming the right knowledge on what we're looking at, right? If it's urinary tract infections and the prevalence with dementia, or best communication strategies, we want to look at the evidence-based research. AI, it's such a loaded question.
It is, but I mean, and I appreciate the research part, and I do want to share this with you. And,
Yes.
And just so the listeners know, Angelica and I haven't really talked about this, but I'm exploring working with a social robot. There's a couple companies I'm working with to help with a lot of the dementia clients. And really what I'm thinking about is using a social robot, because we have a lot of dementia clients that, even people with TBIs, traumatic brain injuries, who tell the same stories over and over again. And if somebody is living alone and they're not ready for care, but we know they're on this journey, why wouldn't you put one in there so that they can listen to that story and be able to listen to it with the same enthusiasm and respond in the same way, so that that person feels like they're validated and they are engaged.
Absolutely.
So I
do think there's definitely some great opportunities for that, right? Even making sure you're programming the AI so that they know the background of this person. Maybe they know where they're living, they know their meaningful engagement, they know their families, right? And it's almost a way to even prompt and help with cognitive decline, right? I know there's a company called Memory Lane Games,
Yep.
and they use AI technology and background of the person living with the disease in order to help stimulate the brain and activate those areas. And I do think that AI could be a great resource for our clients, especially when caregivers are getting burnt out hearing the same story. So then if they're able to talk to an AI that looks like a person or looks like a robot, depending on the person's interest and comfortability levels, that could definitely be a weight off of the caregiver's back.
It's funny you mentioned Memory Lane Games. They've been here on our show before. I don't know if you've met Bruce before, but good people.
Good people.
And you know what? It's good tools. We talked about this early.
Yes.
For the tool belt for that caregiver.
Absolutely.
To really keep the patient or client or loved one engaged.
And that engagement's everything.
It is.
It is.
I mean, look, I'm not an occupational therapist, and I'm not a clinician at all. But I've learned that, in order to delay onset, we need to make sure that they're continuing to take their medication.
Yes.
In the right doses at the right times. We need to make sure that they are eating and not missing meals. And the last part is we need to make sure they're socially engaged.
Yes, absolutely.
And COVID just ruined everything, especially for those dementia and Alzheimer's clients.
Didn't help.
And loved ones. It didn't. We locked them in.
Yes.
Social engagement is so important.
And now it's breaking down those walls, breaking down those barriers, like you mentioned, right? Even though in Arizona we have backyards where we can't really see each other,
Right.
and COVID threw a little bit even more of a wrench in things, that maybe we're going the extra mile, we're going out of our way. That's something a lot of the times, even people in the grocery store, I seem to talk to. If someone looks pretty that day, I like to give them a compliment. One act of service and one kind word really goes a long way. You don't know what someone else is carrying. And a lot of people end up opening up. I can't tell you the amount of people that happen to mention to me that their family members have dementia. And I go, oh, well, guess what? That's a specialty area of mine. I can come and help. And I do offer complimentary consultations with all families.
I love that.
So that I can point them in the right direction.
Right.
Because they shouldn't feel alone.
You may not be the solution, but you can find that solution for them.
Exactly.
And so many are hopeless. And, it's interesting. I think part of the problem with our society today, and I don't want to be a buzzkill here, but, so many people are so fixated on their phones. And, there's nothing that pisses me off, literally pisses me off, was when somebody's either on the phone talking to somebody and they're checking out at the grocery store or at the pharmacy store, or they're on their phone, doing something.
Yeah.
I see people in restaurants. I see families all on their phone and not engaged.
Yes.
I mean, we need to be engaged. We're humans, and we need to have this interaction. And I really believe a lot of this stuff could contribute to possibly memory care and dementia and other things that could be coming.
I
Social
will say,
engagement is so important.
yeah, I do. I support the apps that will give you a timer for how long you're supposed to be on your phone for.
Right.
I do like that. Or making sure, maybe 1-2 hours before bed, we're putting that phone away and getting enough rest. It's so easy and it's addictive to be on our phone.
It's
right?
totally addiction. And look, the swiping,
Yes.
I'm as guilty as the next person. If I'm going to the doctors, and I think you may know this, I just got over a herniated disc. If I'm sitting at the doctor's waiting and I've cleared all my emails, I go out to my social media sites, and next thing you know, 10 minutes have gone, 15 minutes, and it's wasted time. You could be doing something more productive.
Absolutely.
Or productive.
Yes.
And what happens to these young kids? They all have FOMO. They see all this stuff, and a lot of it's fake anyway.
Yeah.
People put that on there.
You see the AI generated symbol these days, and
or
interesting.
AI generated, or they're posing and they're looking like they're having a good time, and they're not.
Yes,
They're
absolutely.
not. So you built a concierge practice. Your model focuses on longer visits, personalized care plans, caregiver coaching, clinical coordination, and private pay services that prioritize quality of life over volume. Why was that important to you?
It was really important to me because I watched and witnessed working in these hospitals that we're supposed to be minute to minute with patients. We don't always see the full picture, right? When I'm rushed with the time and have to constantly look at my watch, that is interrupting patient-centered care. And to be able to build that relationship and that trust with the person that you're taking care of and their family dynamic is really important, to immerse yourself into their shoes. I don't like to give myself limitations of, I have to rush out to get to someone else, because people deserve to be heard, they deserve to be seen, they deserve to be understood. And the difference with the care that I'm able to provide is oftentimes, especially in an assessment, I might find something that someone else might have missed. And it's a small detail, but it's asking all of those questions and all the little things in between, and really listening, really engaging. And I just think that relationship-driven approach in healthcare is changing. A lot of healthcare systems seem to be more business-focused and less client-centered. And as an occupational therapist, as compassionate people in healthcare, right, we know that client-centered approach has to come first.
100%.
And so this concierge model provides just that.
I love it. Are there anyone else out there having a model like that? Did you model it off of anybody, or did you create this all on your own?
Sure. For concierge care, I've looked at Dr. Danny Cabral's practice. She's a concierge neurologist and psychologist.
She's been on my show before.
She's wonderful.
We love Dr. Danny.
Absolutely wonderful.
Brain love.
Exactly. And I've also looked at some other functional medicine practices as well. And this model really comes into play is that I want to be able to serve other concierge doctors and help educate them and help have a strong referral pathway for when OT is needed in care, right? So that interdisciplinary approach is really essential in this fragmented healthcare system that exists today. How hard is it sometimes with basic insurance to get into an appointment? You're trying to see a cardiologist, something immediate happens and you can't get into care. And I feel like, and I know in evidence-based research, that there shouldn't be limitations to getting good health care, right? It shouldn't have to be a long wait list to have a practitioner sit down and listen with you. And in this type of model, not only am I able to serve the person living with the disease, the entire family unit, and then I do a lot of coordination of care. So I have a family right now that I'm caring for, and all of her children live out of the country, right? So I'm really front and center with her care, advocating for her.
You're the eyes and ears.
Absolutely. So I'm the one to say, all right, we need to have a referral to a neurologist right now. We need to call in PCP. We need to get these medications sorted. This is within my practice, and this is what's outside of it. And these are the strengths that we need to make sure we're following. And in that concierge model, the fact that clients are able to get in to see us right away is really essential. especially when families feel like there isn't a lot of hope.
Every minute, every hour, every day counts.
It
and
does.
As I shared before, I mean, if we can get them in a place where we delay, I mean, they're on the journey. We haven't found a cure yet, but if we can delay onset, then we can have meaningful moments and buy ourselves more time.
Yes.
And at the end of the day, isn't that what we all want to do?
That's all what we want.
Absolutely.
We're buying more time.
So, Angelica, if every physician in America changed just one thing about how they talk to families after a dementia diagnosis, what would you want that to be?
I would love for them to close their laptop, get eye level with the patient and the families, and say, this is where we're beginning. This isn't the end. This is where we're going to start, and I'm going to walk you through it together. I have a team of people that are going to help me and help you, and we are going to support your family going through this. You're not alone, right? We've done lots of research. We know the evidence-based care interventions that really do help. And we are going to start there from diagnosis, from day one. Bringing in that sense of community is what is going to make all the difference.
I love that. I hope they're listening. I hope that we adopt this model, if you would, because the diagnose and adios ain't working.
It's not.
Definitely not.
Not for anyone. Not for the doctor, not for the family, not for the person that's living with that disease.
And you know, it's interesting when you talk about doctors, you know, a lot of times the patient is in the room, the family's there, and the doctors aren't talking to the patient. They're talking to the family. And there are patients that say, I'm right here. I know you're talking about me. I mean, we need to give them the respect.
Yes.
We need them, even though they have a brain injury, you know, a disease that they're dealing with, we need to show them that respect.
Yes. I see a mix of both. I see
Sure.
and I hear situations where the doctor's only talking to the person with the disease, and then I hear situations where, like you mentioned, the doctor's only talking to the family. And I do think it's that relationship-driven approach that, you know, maybe the family, if POA, also has a relationship with the doctor. And if the caregiver, the family caregiver, is writing down, you know, these are some concerns that we're noticing.
Right.
But then you're not bringing it up in front of your loved one, right? We're not talking about someone in front of them. And that's something I see a lot too in healthcare and the hospital systems is, you know, we need to involve the client in their care, and we also have to involve their family in a way that is it's all inclusive.
I agree. I mean, it's not just one. It's like you said, it's all inclusive.
Yes.
All right, so this is the part, and you and I saw each other last night at the Navi Nurses kickoff. A big shout out to Jasmine Bhakti, who has been here on the show with me.
She's amazing.
And she's an amazing woman and very inspirational.
Yes.
I said to you that there was a part of our show where I was going to do rapid fire questions. And the reason why I do rapid fire questions, it gives our audience an opportunity to get to maybe know you on a little personal level. So requires one word answers, but if you want to embellish, you can too.
Okay.
And I haven't prepared you. So are you ready?
I'm ready. Let's go.
do it. Coffee or tea?
Tea.
Brooklyn or Phoenix?
Phoenix.
Are you a morning person or a night owl?
Morning person.
What's your favorite way to recharge?
I love just alone time. I love yoga, meditation, deep breaths.
One word that describes hope.
Hope. Joy.
One book every caregiver should read.
The 36-hour day.
I love hearing that. I read that almost 25 years ago. One habit that supports brain health.
Sure. Staying socially connected. And I'm sorry, I'm going to add one more.
Yeah,
Dual tasking, right? So if you're mobile and you're able to go on a walk with a friend, I want you to be moving your body while also engaging your mind.
Oh, I love that. Absolutely. And walks are great for you.
They are great.
And then you can get your mind going too in a
Absolutely.
conversation.
Grab all your neighbors.
Exactly. Most underrated part of healthy aging.
Sure. Underrated is that quality of life is only for the young, right? We should continue living all throughout our lifespan. right?
Like
You're
that.
never too old to do what you want to do, to travel, to enjoy life, to enjoy family time. I see that a lot is clients we get dismissed due to ageist comments, and you're never too old to do what you love.
I always say it's a privilege to age.
It is.
It really is.
Get a lot of wisdom that way.
You definitely do. Where's your favorite place to travel?
I actually, I love Sedona. I go up there a good amount. There's a place called Buddha Beach that I spend a good amount of time at.
Buddha Beach.
Buddha Beach.
I imagine you meditate there.
I do, and there's a little vortex and a little creek I like to swim in. I really enjoy it there.
All right. Well, it's a good place to go during the summer, that's for sure.
Absolutely is.
Beach or mountains?
Beach.
What's one thing that always makes you smile?
Hearing the exciting things that are happening with other people. I really enjoy cheering others on, and I get excited about their exciting opportunities.
I love that. What's one thing families worry about that usually isn't as scary as they think?
Sure, hospice. People associate it with death and dying, but hospice should be associated with hope.
I love that you brought that up. Thank you. People should not be scared of hospice. One healthcare innovation you're really excited about?
I'm really excited about more red light therapy and more modalities in healthcare, utilizing that for support and healthy aging.
Instead of pharmacology?
Yes. Non-pharmaceutical interventions actually have higher levels of evidence with behaviors and cognitive decline than pharmaceutical interventions.
Thank you for sharing that. One thing you wish every medical student learned?
Bedside manner.
Most inspiring patient you've ever met without identifying them?
Oh my goodness. There's been so many. I had a client once, got both bilateral knees replaced at the same time.
Wow.
And that mentally, physically took a toll on this client. And he didn't have a lot of family support. From that initial evaluation, we just bonded. Remember him talking to me about his Buddhist beliefs and how he follows the Dharma and good intentions in life. And I just felt so interconnected to this client. I'm like, I'm going to be here with you every step of the way. And I know there might not be anyone else in your corner, but let me be that person. I actually just had, I took him out for his birthday lunch not too long ago. But patients really do turn into family. And if I could name every client, I absolutely would.
And they inspire you.
They do. They teach me just as much as they feel like they are getting taught as well.
If you could have dinner with any one neuroscientist or healthcare pioneer, who would that be?
Oh my goodness, that is so hard to pick just one. I am getting dinner with Danny Cabral actually coming up soon, and I'm really looking forward to that.
Oh, I love that.
She's done so much fantastic work in the Valley, and I cannot wait to hear her perspectives, especially when mental health comes into the picture. There's not a lot of neurologists that also have a background in psychology, and I think that makes
She's
things...
a psychiatrist.
Yes.
Board certified.
Yes.
She's one of, I think, 11 in the country.
Exactly.
So neurologist and psychiatrist.
And the fact that she is the go-to for that makes a huge difference.
Right.
That's something right now I have a really hard time, especially in the state of New Jersey, finding good geri psych doctors and physicians. You know, they seem to all be really booked out. You can't get a hold of them, and that's normally the one of the number one referrals that I recommend for families, especially if their loved one has a history of mental health challenges.
Agreed. What's the one thing that your patients have taught you about life?
Yeah, I would say to find the joy in every day, right? Because this life isn't guaranteed. Time is not guaranteed. So making sure that you're embracing every day with an open heart and open eyes is really, I think, beautiful and important.
Thank you. I agree 100%. So is there a question I haven't asked or a lasting thought you might want to leave our viewers and our listeners?
Sure.
About you, about Dementia Docs, about the journey that many are probably going to face that might have early diagnoses here today?
Yeah, I want to just say, as a caregiver within your family dynamic, please give yourself grace. You know, what you're dealing with is really challenging. Not everyone goes through this process. You're not alone in it. Please, please, please lean on your community. Lean on your community for support. There's so many of us that have stories to share and can relate to what you're going through. And you really never know the impact that you opening up and being vulnerable, that is such a strength. And to live in that and share that with someone else really has such a lasting impression. So just to know that we're here for you. And if even for the Dementia Docs, if it's something out of my scope of practice, please reach out. I want to help. I want to be able to steer you in the right direction, whether you're located in Arizona, New Jersey, or any place nationally or internationally. I want to help provide you with the support that you need. You know, we're constantly meeting the best of the best out here, and we're all so compassionate about providing for this demographic and this community. And we don't know what we don't know. So lean on us, speak up if you have a concern, and let us help you.
Well, Dr. Angelica Catusco, I got to tell you, the sage advice that I think you just gave in that sound bite, that video bite that we're going to see, is giving your permission to be vulnerable. And I think people don't really do that. They feel like they need to be like this.
Yes.
Even in front of practitioners like yourself, they feel like they can't be vulnerable. They have to be strong.
Yes.
It's okay. We got to give them permission to do so.
Absolutely, especially different cultures, different generations.
Yeah.
We're all taught differently. We're all raised differently. And it's okay to cry. It's okay to feel your emotions. It's welcomed.
Mm-hmm.
It's a safe space to feel how you need to feel and not suppress it.
And actually, sometimes a good cry, you feel better.
You do.
Believe it
It's
or not.
therapeutic. It is so therapeutic.
Angelica, thank you. You've been incredible here on our show. I can't believe this is like your really first in-studio podcast because you are a pro, and I definitely want to have you back. I'm a big fan of Dr. Danny Cabral too, and you know, Brain Love is definitely something she's really got a handle on.
Yes.
I think you've got a great career ahead of you with Dementia Docs. One more time for our viewers and listeners, how do they find you?
You can find me on the dementiadocs.com. Thank you.
Thank you so much.
Thank you so much, Bob. I appreciate you so much.
I appreciate you too.
Thank you.
And for you, our listeners and viewers, next week we'll be back with Health Futures with another guest. So please tune in. Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years, it's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.